Just as sunflowers chase the sun, inductees into the South Dakota Hall of Fame chase their dreams day after day, year after year. The 700-plus inductees in the Hall of Fame come from all backgrounds and corners of our state. What their stories have in common is their unwavering courage and belief in their dreams. These dream chasers are an inspiration for us all to strive for excellence and believe in our own potential to chase dreams well into the future.
Dodie Brown was a key player in the development of home health and hospice programs across the state of South Dakota. She worked with legislature and Department of Health to develop licensing for residential hospice facilities. Dodie assisted in developing a Title 19 benefit for hospice care, and she helped develop regulations to ensure quality care in South Dakota. She has shown innovation in her approach to making home health care accessible. Dodie took the local experience of home health and hospice and brought it statewide by serving on many state boards, such as South Dakota Home Health Association and South Dakota Council on Home Care.
Tell us a little bit about your story. What's the Dodie Brown story?
Well, I was the director of home care for a number of years, and in fact started in the health department as a staff nurse when we were developing home health care, which was only established by Congress in 1965 through Medicare. So in those early days, we were really growing services for home care. And I became a director of the program in Pennington County. And during that time, I think I'd have to say I was inspired by the staff who actually came to me and said, we really need to do more. There's terminally ill patients in our community that need more than what we're providing. And they were really the spark plug behind all the dreams about our getting to the point where we actually could become a hospice provider.
I can only imagine even in the last century, the path of healthcare from when people lived with their families, they were taken care of at home. There were so many advanced professional services, but it sounds like what you saw in the vision was this return to home health care. What was the pulling those ideas together as a leader? What was that vision that you saw with your group?
Well, I could see essentially through the personal experiences of our staff and in our community that this was the direction we needed to go. That we were moving away from just everything being provided in a hospital and acute care, and that wasn't the comfort level that people wanted, especially when they're dealing with a long-term or chronic or terminally ill diagnosis. So home care was the answer, and hospice was an expansion out of that with a team effort, which was really the essential piece of why it was successful. We were looking at a combination of the patient's physician, nursing, social work, chaplains, volunteers, all coming together to provide a coordinated service for the patients and their families. And that was unique in that at that time. And it built on really the values that people have. They want to be at home, and the comfort of being near their families for whatever time they have. And so hospice really was an answer to those kind of needs. But even though that's what they wanted, they didn't know what to ask for.
In the process of building the program in the Rapid City area, there had to be some point when you could see you were venturing into a little bit of area of unknown. That I get the feeling that you felt you were on the right path, but there was a lot of work that had to be done, and you might not know exactly what that is. How do you overcome that and keep moving forward?
I think that strong belief in what you're doing, and I was, along with our team, I was so convinced that we were on the right track, and we were following a national trend, and we were, I guess, the persistence of saying, we knew that we had to do it. If we didn't, nobody else would. And we believed in it so strongly that we were knowing we were on the right track, and we had so much to offer patients and families that we just, you accepted where we were and kept moving on and kept doing the things about getting to groups, getting community people to know what to ask for. And once they understood the Medicare hospice benefit, which was providing so much service for people, that it was mainly a process of teaching them what was valuable, what was available, and having their families be more comfortable embracing it and asking for those services.
You've described at least what I hear as a very strong public service, public good ethic that is part of your life, but that has been your career. Is that correct? And does that, have you seen that sort of care for your neighbor and public service spirit pay dividends in other parts of your life?
Oh, I think it's just, I have to say that my legacy has been in that work. And I see that back to me after I've retired, that I still live in the Rapid City community, and there's so many times when people will come up to me in some kind of setting and thank me for the work that I did in hospice, or if they've had an opportunity to have a family member stay in our hospice house. That has just brought home the appreciation for what my team and I did over the years, and it is growing but I think the contact with community is ongoing, and that does make me feel that we did something good for our community, and at a time when they really needed it.